Hi, everyone. I see people filing in. I'm going to start to share my screen. There we go. Welcome, everyone, to our October ALS Learning Series at the Les Turner ALS Foundation. Before we get started today, and I introduce you to Dr. Tavee, I just want to remind all of you that are coming in that you are muted and off screen, so just sit back and relax. The presentation should go about an hour and we'll save time at the end for questions. You'll notice that the chat has been disabled, but if you have any questions, please enter those in the Q&A section because I'll be able to, you'll be able to submit and then we can ask those at the end. All right, I'm Anne-Marie Doyle. I'm the Community Education Manager here at the Les Turner ALS Foundation. And before we get started again, I just want to thank our industry partners like Mitsubishi Tanabe Pharma and the Gilbert and Jacqueline Fern Foundation, because without their help, we wouldn't be able to do this. Now, we know that living with ALS can be really overwhelming, and you might have a lot of questions and might not know where to start. We are always here to help. You can visit our website at lesturnерals.org and check out our educational tools. So we have a couple different decision tools. If you're curious about if non-invasive ventilation or G-tube or genetic testing is right for you, you can definitely check out those modules. We also have some great information guides covering a wide range of topics from ALS and breathing to ALS and genetics. And then lastly, you may just want to check out our catalog of different ALS learning series that we have. Those are also on our website. We'd also love to invite you to our Les Turner Symposium on ALS. That is this Monday, November 4th. There is an in-person, but also a virtual registration. So you can learn more by just scanning that QR code or visiting lesturnерals.org/symposium. We'll have Dr. Angela Genge. She's our keynote speaker. And then, of course, if you're interested in joining the National ALS Registry, please check out cdc.gov/ALS. A great way to make sure that the registry knows that you have ALS. They can filling out those surveys helps them learn more about ALS. And it can also connect you to certain clinical research. All right, so with that being said, I am so excited to introduce you to Dr. Ginny Tavee. She is the Chief Division of Neurology at the Department of Medicine at National Jewish Health. Dr. Tavee has a special interest in integrative holistic medicine and teaches meditation to medical students, patients, physicians from all over the world. She's actively involved in researching the effects of meditation on chronic neurological diseases and has led meditation retreats for cancer survivors and injured U.S. Marines returning from the Gulf War through the Wounded Warrior Program. She also has completed a clinical trial evaluating the use of yoga breathing for people living with ALS. Welcome, Dr. Tavee. We are so excited to have you today.
Thank you, Anne-Marie.
Yeah, I will stop sharing my screen.
Okay.
Perfect.
And let's see. All right, can everybody see my screen? Does it look okay?
Yeah, that
Very
looks great.
good. So thank you, Anne-Marie, and thank you to the Les Turner ALS Foundation for having me here this morning. You guys are amazing. Thank you for all that you do. And thank you to all of our patients and caregivers and everybody who has joined us today to talk about integrative holistic therapies for ALS. So just a little bit of a background, I was at Northwestern for a few years, and then when they recruited me at National Jewish, which is a big pulmonary hospital in Denver, in 2020, my residents at Northwestern said, "Why is Dr. Tavee leaving us for a hot dog company?" And I said, "That would be Hebrew National, but those are good hot dogs." So we do have an ALS multidisciplinary care center at National Jewish as well. And so we see ALS patients on a regular basis. Now, when I talk about integrative holistic therapies, I always like to start with nutrition. And the reason why is we all have to eat. And looking at what we eat, how much we eat, is one of the easiest things we can do to start making a change in our life. And the concept of food as medicine is nothing new. The Chinese have been doing it for thousands of years. So for ALS patients, what's the evidence? I think that most of us know that if you have a low-calorie diet, it's supposed to be better for us, good for our health, good for a long life. Not true for ALS patients. It's quite the opposite. Patients who are overweight, maybe mildly overweight, we're saying BMIs of 30 to 35, actually have a reduced risk of ALS. They also, if they're going to get it, they get it later in life. It's a later disease onset. And if they do have it, they survive longer. The flip side is true for patients who are thinner and who have lower BMIs, especially those who are rapidly losing weight. Unfortunately, you have 7 times the risk of mortality if you are thinner or rapid losing weight than those who are normal weight or overweight. And nobody's quite sure why this is. One of the proposed mechanisms is hypermetabolism, meaning because of the muscle weakness, because of what's been going on, when you and I walk across the room, it takes 10 times the effort that you do than it does me just to do something as simple as walking. And it's all about energy balance, energy in, energy out. And the expenditure is more for ALS patients. So I tell my patients, partially jokingly, I say, I don't care if you take a Snickers bar and dip it in mayo and that's your lunch. I just want you to eat. And I am just kidding, but partially kidding, because I don't want you to lose weight. And Merit Sidovich, many of you may have heard of her. She's one of the top ALS researchers in the world. She's at Harvard. One of my patients actually sees her on the East Coast when he's out there. And he told me that, after she saw him, she said, "There's a donut shop on the first floor of the building. I want you to go down and get 2 donuts and eat them today." So it's something that's known, and I think she's only partially kidding as well. So which diets are you supposed to eat? Well, logistically, if you're supposed to be gaining weight or at least maintaining weight, you need to have a high-calorie diet, right? So we're thinking maybe 20% more than what you actually need. And the way to do this, you can do a hypercarb diet, hyperfat diet, but one of the safer ways may be a hypercarb diet. And that actually has been shown to be relatively safe and well tolerated. Unfortunately, when you look at the clinical data, the survival benefit, there's something in mice, but they looked at a number of trials, and there hasn't been a huge benefit at all with a hypercaloric diet. So what I would say is use common sense, maintain at the very minimum, try to maintain your weight. And it's okay if you want to have some ice cream or a Snickers bar or whatever you want to eat, just eat. Another diet that's been looked at is a ketogenic diet, but it's been with mixed results. And you got to be really careful. A ketogenic diet may have anti-inflammatory, antioxidant, anti-glutamate properties. They've looked at it for epilepsy, which it definitely works for seizures. It may be helpful for Alzheimer's, but for patients with ALS, what do we use ketogenic diets for in the general population? People want to lose weight. This is not what you want. So I'd be very, very careful. And unless you just love bacon and don't want to eat spinach or fruit, I would not recommend the ketogenic diet for any of my patients. All right, omega-3 fatty acids. So this has been studied for many years. And, you know, initially there was some benefit in patients, especially with alpha-linoleic acid. They were saying that you may have a reduced risk of developing it. Then there was a mouse model study that came out. And then what they had done was they had given mouse models supplements, and they actually got worse. And so the data was like this. And then last year, a Harvard study came out and found that omega-3 fatty acids, higher levels, not supplementation, but when they looked at the blood levels of omega-3 fatty acids, specifically one of the fatty acids called alpha-linoleic acid, which is found in flax seeds, chia, hemp, reduced the risk of death by 50% compared to those who had lower levels, and it was associated with a slower decline. So that got a lot of press. It's, again, very careful. It's not about taking the supplements, it's just the levels. And what I tell patients all the time is, if you need vitamins, get it from real food. Try not to get it from pills. I mean, if you have to, if you're unable to take the real food, that's okay. But just if you can take the real food, get it from fish. That's eicosapentaenoic acid, but get it from flax seeds. Make a chia seed pudding. There's so many things you can do and then add it to smoothies. You can add it to your tube feeds, but there are the ways you can get omega-3 fatty acids that are quote unquote natural. Okay. There hasn't been any good clinical data on the actual supplements, but if you're going to do the supplements, because I talk about this with other diseases, I would take 1 to 2 grams a day. It doesn't matter if it's eicosapentaenoic acid. There are all these ratios. It doesn't matter. Just get the omega-3 fatty acids, take 1 to 2 grams a day. A little bit higher can make you bleed a little bit more, because remember, we use this for stroke prevention and heart disease prevention. So it makes your blood run a little thin. So 1 to 2 grams tends to be safe. If you hate the fishy taste, put it in the freezer, and then you can have it frozen, and it just gets rid of the taste. The gluten-free diet. So in non-ALS patients, I think this is a good diet for potentially autoimmune diseases. We don't know, there's not enough data, but we think that gluten, which is a protein that's found in wheat and wheat products, may be pro-inflammatory. And, you know, theoretically, gluten may cause autoimmune issues in patients, which could potentially trigger ALS, but there's not enough data for that. And they did find that in patients who have celiac disease, which is an actual allergy to gluten, there's no increased risk of ALS. But again, like the keto diet, I don't want you to lose weight, because what happens with gluten-free, people just stop eating carbs and they can lose weight. All right. Here are some diets to be careful about. As we talked earlier, an increased calorie, a high calorie diet can be done in a number of ways. Probably hypercarbic. I mean, eating more carbs is safer. There was one study that looked at patients who had Oxipa, and I may be saying that incorrectly, I'm sorry, but Oxipa, which is a supplement, a dietary supplement, and it's 55% fat calories. The patients who did this compared to a hypercarb diet couldn't tolerate it as well. They had more stomach upset, more bloating, they didn't like it. And there were a few more deaths in this group compared to those with the hypercarbic group. But it's not enough to say that it increases your risk of death, but it's just not as well tolerated. The Walls diet, I don't know if anyone's heard of this. This is similar to the paleo diet, which is lean proteins, lots of leafy green vegetables. I mean, again, in theory, it's a great diet. The individual components of the diet are good for you in general. The beta carotenoids, all of those things are good. Unfortunately, they looked at it in an MS clinical trial, multiple sclerosis. There was a 7.2% BMI loss in the MS patients. This is not good for patients with ALS. So again, I'd be very, very careful with this. And then finally, we had the Deanna protocol. Again, this is one of these diets, these things that have been out there. You can see it on the internet. They've looked at it for MS and other things, but the Deanna protocol was created by an orthopedic surgeon whose daughter had ALS. And he came up with a list of supplements that have been changing over the years. And the ad marketing is winning the fight against ALS. And the supplements can be ordered online. There was one clinical trial, it was actually in mice, that found that it may be helpful for patients with, or for ALS mouse models. However, no one has been able to reproduce the clinical findings that they found. And it's very expensive. It's at least $400 a month if you get all the supplements rather than just some of them. So this is actually not recommended right now as well. So what can you eat? What are you supposed to eat? So as I said before, carbs, right? This is the opposite of what I tell my other patients, but we do want you to eat carbs. So things like quinoa, brown rice. Quinoa looks like quinoa, but it's actually a South American super grain that looks like couscous, and it's very good. It tastes kind of like rice, couscous. You can make salads with it. You can use it as rice. Oats, bananas, oranges, sweet potatoes, all of those things are healthy carbs. Protein, protein, protein. I push the protein for my patients. Fish, chicken, lean cuts of red meat. I know steak can be hard for a lot of ALS patients, so drown it in gravy, put it in A1 steak sauce. It doesn't matter. If you like it, it's okay to have it. And then, of course, beans, lentils, chickpeas, you can have hummus. All of those things are very healthy ways of trying to maintain muscle. Fruits and vegetables, the American Cancer Society, the American Diabetic Association, the American Heart Association recommend 5 servings of fruits and vegetables a day. If you're going to eat it, eat the brightly colored ones like tomatoes and berries and spinach, because all of the nutrients are in the pigments. And then berries, these are your brain food, and you do not have to get acai berries, which are the fancy Brazilian berries. Just go out and get blueberries, right? And they found that blueberries actually have the same chemical as an Alzheimer's disease medication called Aricept, acetylcholinesterase. And what they did was they did a study many years ago in mice. They took older mice and younger mice. They fed the older mice blueberry chow, and they fed the younger mice, whatever mouse chow they had. And they did this for a number of weeks, and then they put them through a water maze. The older mice, some of them actually outperformed the younger mice. So it's something to think about. And I think blueberries are great from Michigan. It's always great to get organic. If you can afford it, go for it. But I would say it's just better if you can just get it locally, or if that's all you can get just at the grocery store, fine, just take it. And then dark chocolate. Yes, I did say chocolate, but make sure it's dark chocolate. This has a lot of wonderful nutrients. It has flavonols that increases your cerebral blood flow, theobromine, which helps you sleep, and it may be associated with a reduced risk of dementia. Just don't eat it right before you go to bed. For most patients who don't have ALS, I'll say it's 2/3 of a truffle ball. That's the amount that people are recommending each day. But for my patients with ALS, you can have as much as you want to, okay? It's fine. And then nuts. Nuts are an incredible source of protein, minerals, and other nutrients. Brazil nuts have selenium. And selenium was actually studied in ALS years ago as an antioxidant. I don't think it panned out, but it's just an overall good source of, it's just an overall good antioxidant. Cashews have copper and magnesium. Copper is great for the brain and the spinal cord. You need it. And then magnesium is needed for your muscles, and it helps keep things calm. And as many of you who have cramps know, magnesium can help with cramps. So cashews are a natural source of magnesium. Almonds have calcium and vitamin E. Vitamin E is also a great antioxidant. Pistachios, the skinny nut, that has lutein and B6. Lutein is good for your eyes. And then walnuts. Walnuts have omega-3 fatty acids. So a lot of these nuts have things that you need as an ALS patient. All right, what are some specific things that we can eat for cramps? Foods rich in potassium, calcium, and mag. As I said before, magnesium is great for cramps. So again, we come back to sweet potatoes and bananas and avocados. Living here in Denver, 5,000 feet above sea level, everyone pushes hydration. But also for ALS patients, it's very important for you to keep hydrated. You can get one of those big, water jugs and just put a straw in it and just drink water all day. And especially if you're going to work out or if it's hot outside, I remember those Chicago summers, keep hydrated. For some of you, you're not going to be able to eat a lot at one time. It's very hard. You don't have an appetite. That's okay. Just eat when you can. Eat frequent small meals during the day. And then, if you're going to work out, you're going to be on the bike, carb load. Do not fast. Please, please, please do not fast. Now, there may be some religious reasons why you need to fast, but even then, I think it's said that if you have a medical reason, you can be exempt. And then for patients with severe cramps and you don't want to take medications, pickle juice. Pickle juice can actually help. The marathon runners, they will drink pickle juice when they're in the middle of a run to help reduce cramps. And I actually had one of my patients had a hereditary neuropathy, and she had horrible cramps with the neuropathy in her legs. And she and her grandma had the neuropathy too. Remember, this is hereditary neuropathy. They would do pickle juice shots every night before they went to bed. And what it is, it's the vinegar component. And vinegar does, it does something to the spinal motor neurons. It inhibits some kind of reflex. And so it can potentially help with cramps. And I had another patient. She didn't know why she did this, but she has neuropathy, severe neuropathy and cramps. After she would have a salad, she would drink the oil and vinegar dressing from the plate, and she just loved it. And she felt good after she did that. And I think it's because of the vinegar. All right, switching gears. Exercise. For many of our patients, exercise is their only saving grace. But patients are always asking things like, what should I do? What can I do? And so Matt Sutcliffe was the head of the neurophysical therapy at Cleveland Clinic for many years. And he created these rules, the 4 rules of exercise, and I love them. The first thing is you pick something you like. I don't care if it's Zumba or running or elliptical. Pick something you like or you can tolerate. Because if you don't like it, you're not going to continue it. Just think about it. What's the number 1 month everyone joins a gym? January. And what's the number 1 month everybody quits the gym? February. So again, you want to pick something that you can actually continue to do. And the number 2 is the most important rule. People are asking me, well, how much can I do? How much is too much? And the 2-hour rule is this. Let's say you do the elliptical, okay? And then you do it for 20 minutes, and then afterwards you feel kind of down or crappy or fatigued. That's okay. That's normal. What you feel 2 hours later is the important thing. At 2 hours, you should be refreshed or you should feel neutral. If you are still feeling fatigued, that was too much, go back and change it, okay? Number 3, try to do something every day. I know it can be hard, especially if you're feeling bad, you're having a bad day, but even if it's just getting up and walking around your house or walking down to get the mail from the mailbox at the end of the driveway, that's fine. Just try to do something. And number 4, very importantly, no pain, no gain does not apply. You will pay for it. If you do too much, you will pay. So just be careful. So what kind of exercises can I do? Probably one of the basic ones you can do and that can really help, at least with pain, is stretching. All these stretching exercises, it's safe, there's no resistance, and it can make you feel good. Just the stretching, getting out there, doing something. And it's also important, even if you're weak, even if you're completely paralyzed in that limb, stretching is very important. We had 2 patients who came to us at the same time in Cleveland. I was at the Cleveland Clinic for almost 20 years. I started when I was 5. I just tell people that, so I'm still very young. But we had 2 patients who came with bibrachial ALS, which means that they can't move their arms, right? And it was completely paralyzed. One patient did stretching every day. He would throw his arm back to the back of the chair, and then he would stretch, or his wife would pull him, or the physical therapist would help him, and he would stretch his arms every day. The second patient, same thing, but he kept it in the sling. He babied that arm. He didn't want anybody to touch that arm. And so over time, that guy developed pain. He had a frozen shoulder. He couldn't move his arm. He had pain all the time. Whereas the other guy, even though they were both weak, could still, do this. And and he didn't have any pain at all. So stretching is going to be very important. And that's something you can do even on a bad day. Just have somebody stretch out your limbs, and that's it. Graded exercise, meaning, let's say you find a good exercise that you like. Don't just do an hour on the elliptical because you love it. Start slow, okay? Start low and go slow. Maybe 2 minutes, then 5 minutes, and build up until you hit that 2-hour rule. How much per week? Well, for patients with metabolic syndrome, diabetes, people trying to lose weight, they're saying 150 minutes per week, but it's whatever you can do. If you want a goal number, it's a round goal number. But if you don't have one, just I want you to do something every day. Aquatherapy for patients who don't have a lot of breathing issues yet, and the water doesn't cause too much resistance when it comes up to here. Aquatherapy can be great, especially warm water, aquatherapy, shallow water, getting in there with a noodle and moving your legs around, or doing walking in a pool. That can be good for you too. A recumbent bicycle where you're low down to the ground and you're safe and there's no risk of falling. They even have like a pedaling machine that you can do. And I threw this into exercise, but I think massage could be helpful as well. All right. I've never used to talk about this before, but in the last couple of years, I've really understood how important sleep is to everyone, and especially to patients with neurodegenerative diseases, because sleep is restorative. And we're seeing more data now that if you get less than 5 hours of sleep a night, you are twice as likely to develop dementia compared to those with 6 to 8 hours a night. It also increases your risk of death. And people are saying, okay, well, how much sleep should I get? Everybody is different. Some people can get by with just 4 or 5 hours a night and they're fine and they're not demented. But if you just want a round number to work with, 7 hours seems to be the optimal sleep time in most studies. And there was another study that found that if you got 6 hours or less a night, you have a 30% increased risk of dementia compared to 7 hours. So again, these are round numbers and everybody's different. And here's some tips that can help you get to sleep. Sleep hygiene is going to be crucial. And one of the rules that I found online, I found this on the Australian Public Health website. So I didn't make this up. And I actually found this in a New Jersey public health site too. It's the 10-3-2-1 rule. 10 hours before you go to sleep, no more caffeine. 3 hours before you go to sleep, stop all food and drink and alcohol. 2 hours before you go to sleep, stop working. That's my problem. And 1 hour before you sleep, stop all screen time. No phones, no iPads, no television, just cut it. Also, reduce alcohol, because I know some people may say, oh, but it helps me sleep, but it's not good sleep. It disrupts your sleep architecture. So reduce it, cut it if you can, and try not to drink right before you go to bed as a way to sleep. As it gets darker, it's getting darker now, but when it's getting close to bedtime, use floor lights, dim lights, and turn off overhead lights so that it tricks your brain into thinking, okay, it's time to sleep now. And then a study just came out recently looking at what is the most important aspect of sleep, especially for living longer. And it's funny, it's not the number of hours you get, it's the regularity, it's the consistency. As long as you're getting a consistent number of hours per night and it's good quality sleep, and you're going to sleep at the same time, that actually can reduce your risk of premature death by 48%. So again, some people get away with 5 hours, 6 hours, that's fine. Just make sure you're doing it every single night and try to go to bed at the same time. Some other things that can help you that have been shown in the literature to be of benefit: yoga, acupuncture can help you sleep. Tai Chi, which is a Chinese mind-body therapy, is an exercise. You see these, these old women in Hong Kong doing, cloud hands in the park. That's good for you. Mindfulness-based stress reduction is a form of mindfulness meditation that probably has the most clinical data behind it. It's meditation, it's yoga, it's, all these different practices, and you can get online to find out some ways to do that. Melatonin, for somebody who wants just something a little bit easier. It has the clinical trial background for jet lag, but it can also be helpful for insomnia too. The optimal dose is about 3 milligrams. You take it 30 minutes prior to bedtime. And then for those of you who are granola and who just want the more natural form, tart cherries have melatonin. So I don't know how many tart cherries you have to eat, but it does have melatonin, and you can also get tart cherry supplements. Which brings us to supplements in general. And this is tough because none of these are FDA regulated. They're over the counter. You don't really know what you're getting. But there has been some promising findings in studies of mouse models and very rare clinical trials. They're not the greatest quality studies, but they do give us some information, and you can make a decision about whether or not you want to proceed. You can talk to your doctor about it too. The latest ones are ashwagandha. This is an herb. It's been around for a long time. You can find it in Asia and Africa. But the thing is, this herb has been used for depression and anxiety and high blood pressure for years. You can probably find it at Walgreens, right? You can find it at all these other places in capsule form. However, in mouse models, it has been shown to improve motor function and preserve motor neurons in at least 2 or 3 studies, probably even more, because they even looked at all these different genetic knockout mice. So actually, a number of studies have shown this. It's very promising. There has been one clinical trial looking at patients, and they used 2 doses, 1,088, and then half the dose, 544. The results aren't out yet, and the people from ALS Untangled, which is a website that looks at all these supplements, it's composed of big-time ALS researchers who look at the data and produce, a nice paper for everybody to read so you can make an informed decision about what to take. And they do this with all different kinds of supplements and therapies. But anyway, they actually tried to reach out to them, and they just don't have the results. So we just don't know, but at least in mouse models, it looks very promising. Acetyl L-carnitine, which I recommend for my other patients who have, muscle disease or neuropathy. It's an antioxidant. It's a natural protein that we have in our own bodies already. It helps with the mitochondria. But 1 gram 3 times a day may slow the decline and increase survival. We just don't have enough information. It won't hurt. It's one of the things where it doesn't hurt, might help. So if you want to try it, you can. The only side effect I've seen in my practice, you can get a little bit of GI upset, but it's not anything major, and most patients tolerate it very well. So it's something to think about. Vitamin E, they tried this. It's a very powerful antioxidant. They've talked about it in Parkinson's disease, but there's no effect on survival in clinical trials. But in mice, it may delay the onset and reduce your risk of getting ALS. So again, won't hurt, might help, but if you're going to do it, I would get it from real food, like almonds. All right. Curcumin, also known as turmeric, it's a yellowish powder that you will see in Indian cooking. Some people will put it in their cooking anyway. I put it in my eggs before. And they've done it in studies. It's a very powerful antioxidant. Unfortunately, you have to have a lot of curcumin to really make a difference. So you can't just use the powder. You'd have to get like the supplement, and it does come in pills. They did a study looking at patients, and they at 80 milligrams of curcumin supplements, and they were taking it for several weeks. And at the end of the trial, there was no there was no improvement in ALS decline or any of the quality of life scores, but there were fewer major events in the patients who did take curcumin. So there were fewer people who had to go on the vent, and there were fewer deaths. So it's unknown if it really helps, won't hurt, might help kind of thing. It might help with other things. Melatonin, data is mixed. It may worsen neurodegeneration. Nobody's quite sure. So it's up to you if you want to take it, but the jury's still out, and I'm not recommending that. Vitamin D. Now, again, just like the omega-3 fatty acids, they weren't looking at supplements. They were just looking at the levels in the blood. And they found that those who had a lower level of vitamin D were at increased risk of death. So if you want to take vitamin D supplements, there's no data on supplements actually, but we usually recommend 1,000 international units a day. If you want to, you can do 2,000 if you're not in the sun, if you're very pale, if you have a history of low vitamin D. Resveratrol is a polyphenol, which is, an antioxidant. You can find it in grapes and berries. There's not enough data to recommend it in patients, like a strong recommendation, but it may improve survival in mice with ALS. So again, if you want to try it, you can. The issue is that taking all of these antioxidants can be expensive. So you got to pick and choose. I would choose the ones that seem to have the most data. All right, and here are some that don't have data or there was no change in clinical trials. I think one thing that people, we had all these super trials with CoQ10, many trials, and they were just a bust. Lion's mane is this hot new thing in Denver. Lion's mane is a mushroom, and it's a supplement. It's supposed to be a very powerful anti-inflammatory agent, antioxidant. People, you can go to a tea house and get lion's mane in your tea or a coffee. But in the setting of ALS, there haven't been any clinical trials yet for ALS. And I don't think that there's been enough data to say it's been helpful in mouse models, but there have been a few case reports and somebody actually developed an anaphylactic reaction to lion's mane. So be careful. It's up to you. Again, you have to pick and choose your supplements, but it's a very popular one here just for the anti-inflammatory properties. Caffeine. So caffeine has gained some press recently. There was one study that showed that you have a reduced risk of ALS with caffeine, but then subsequent studies have shown no reduced risk. It's the same. And in mouse models, there were some that actually worsened the mice. So you have to be careful. The other thing is it can reduce the clearance of Relia-Tech, which means that Relia-Tech can build up in your system. So you'll be more prone to develop side effects from the Relia-Tech with a lot of coffee. Now, 1 to 2 cups a day of coffee is safe. It's fine. We're talking about, 3 to 5 cups a day. So I would just say if you like coffee and it's something you really enjoy and it perks up your day, that's fine. But I would not take it as a supplement to try to reduce your risk or reduce mortality or decline. And there was one study on vitamin A. Vitamin A reduced survival in mice. So I would avoid a vitamin A supplement. All right. There was a Japanese trial that came out a couple years ago looking at mega doses of B12. And a normal dose of B12 for someone who is deficient is about 1,000 international units a day or 1,000 international units if you're going to inject it weekly. But in Japan, they looked at 130 patients with very mild ALS. Nobody was on any kind of respiratory support, okay? Very mild ALS, early stage ALS. And they gave them methylcobalamin, which is a formulation of B12, at 50 milligrams twice weekly. Remember, I was saying that the dose we gave was 1,000 micrograms. So 1 milligram is way more, 3 times more important, or it's 1,000 times more than 1 microgram. So these are mega doses, and they were injecting them for 16 weeks, and they found that there may be a delay in functional decline. So it's going to be tough to get that high of a dose in the US because I don't know if it's formulated that way. But you can at least try to go and get B12 injections from your primary care physician. They can give you a prescription. And I don't know what you have in Chicago, but in Denver, we have IV bars where you can just go in, pay $80, get a liter of normal saline hooked up to you for IV fluids and some B12 and other vitamins. And one of our former nurses in our infusion clinic had done these IV bars in the outside, and she said, well, it's not exactly God's work, but it's something that I enjoy doing. So she was doing it for extra money, but they are all over the city. And if you want to do that, you can. And those are increased doses of B12 compared to what you can get from your physician. It seems to be safe. I'm not worried about high B12 levels. Medical marijuana, that has shown to be helpful in for a number of symptoms in patients with ALS. It can help with appetite, right? A lot of patients don't have an appetite. It can help with spasticity, saliva management, mood disorders. never, ever smoke it. We don't know the long-term effects of smoking when done for medical reasons. If you're going to do medical marijuana, there's so many ways you can get it. You can get it as a tincture, which is like a little liquid. You can get it as a gummy. You can get it as fudge and chocolates. I wouldn't do the cooked kinds like brownies. And the reason why is you don't know how it's going to really end up. It's not predictable. Whereas gummies and tinctures, it is what it is. And the reason why CBD may be helpful, so medical or marijuana is composed of over 100 different compounds, and CBD is one of the most well-known ones. You have CBD receptors throughout your brain, your spinal cord, and your nerves. So it may be working on a physiological basis at the level of the brain, the spinal cord, and nerves. THC is another well-known component, and that is what gets you high. So that is one of the side effects that you have to be careful about. It causes memory loss, cognitive impairment, and it can make psychiatric disturbances even worse. And some patients can have what we call hyperemesis, where you just keep throwing up. It's not common, but it is reported. So you have to be careful. Diversion, someone may get it from you and it goes to the wrong people or kids. And of course, it's not federally regulated. So for those of you who are still working, there is no guarantee that you, especially if you're employed by the state or by the government, you cannot have marijuana in your urine or your blood, because they, especially in as a physician, you have to be careful. As a policeman, teachers may be okay, but anyone with a government contract, you have to be careful as well. All right. And then finally, we go to mind-body therapy. So these are things like acupuncture, yoga, meditation. And there's been actually a number of studies looking at acupuncture in ALS. It's usually in combination with herbs or different kinds of acupuncture techniques. The studies themselves aren't of the greatest quality, but there seems to be improvement. And there have been at least 70 studies throughout the world. A lot of them are coming from China and Asia. But pain control, difficulty swallowing, muscle wasting, excess saliva have been found in these trials that are of low quality to be helpful. There was a teeny tiny improvement in oxygen saturation. It probably wasn't even significant, but these are just some of the things that have been shown to be outcome measures that they've looked at in these acupuncture studies. And again, they're very, very low quality studies. But again, it won't hurt, might help. Be careful about the herbs they give you. You don't know what's in them. So if you want to just try the acupuncture, that's fine. I would go to somebody who is well trained in one of the Asian traditions usually. And a good acupuncturist will be honest with you and won't try to fleece you. They'll say, let's try, I don't know, 5 treatments for $100 each treatment. You know, they're very upfront about the pricing. And then you have 5 treatments scheduled. And if it doesn't work, they stop. Don't keep going if it doesn't help. You know, you have to have, you know, just a subjective, just a limit. Yoga, and we're going to be talking about yoga breathing in just a few minutes, but restorative yoga, not the 19-year-old Lululemon, look at what I can do, hot yoga. I want the restorative yoga where you're kind of lying on the ground, you're doing these relaxing techniques, and that can be helpful as well. It can also help with cramps. And then mindfulness meditation. Oh, we're running out of time, but mindfulness meditation is non-judgmental awareness of the present moment. So just being right here in the moment. And you know, if you're cold or you're hot, you're not like, I'm cold. Where's my sweater? I don't like being cold. It's not like that. You just want to be, I'm cold, and that's it. Let it be. No drama. And some basic techniques would be for you to focus on your breathing. You can do it right here at the end of your nose. Don't force the breath, just let it be the way it is. And then here at the chest and the abdomen, where your breath, your diaphragm rises and falls, just feel it. And if the breath goes, and if your attention goes away, bring it back and just feel the breath. Feel the chest as it rises and it falls. If you want to do mindfulness in just your thoughts, you try to just focus somewhere. And if thought comes, you acknowledge that thought and then disengage when you see that it doesn't help you. You don't need to be thinking about that right now. Disengage from that thought and return to the focus. You can use Some people who are Catholic can use rosaries. Some people who are just Protestant, you can use a cross, you can use religious things, whatever your faith is, or you can just use a nice stone or whatever you want as your focus, or a ring or a bracelet. And then of course there's walking meditation, walking quickly, not paying attention to what people are saying, nothing with iPods, nothing with, iPhones, nothing with your dog, just walk and walk quickly. And then other things you can do for mindfulness practice every single day. You can do the sitting practices, just what we talked about. Be mindful when you're eating. Do you know how many times that you will eat, and before you've even finished what's in your mouth, you'll have the fork ready to eat another bite? They say that you lose taste. Taste doesn't become an issue. A taste no longer becomes an issue after the first 3 to 4 bites, because all we do is we just feed our face. So eat what you have in your mouth, finish it, then bring the next spoonful up. Mindfulness in your car. Let's say that somebody cuts you off in traffic on the Dan Ryan Expressway. Before giving them a lovely finger gesture, take 5 deep breaths. It really helps, and it resets your mind. Mindfulness with walking, we just talked about, and mindfulness at your desk. If you're still working, if you're at your desk, if you're at your computer, look out the window. Like if you're just getting super stressed out, look out the window just for a moment. If you don't have a window, look at the ceiling, and you'll see a shift. That the shift in your gaze is going to be a shift in your thoughts. You'll just come back, even if it's just for a moment. It's like your own personal Control Alt Delete. Just resets you just for a moment. And this is my patient, Phil Greco. You can see him with his granddaughter, Etta. So Phil has ALS, and he passed away last year, but he battled with it for several years, and he had some benefit with yoga breathing. And his teacher was kind enough to be in a clinical trial with us, and he funded a very, very small study. And what we did was we did Zoom tele-yoga breathing in 2019. We did Zoom before Zoom was cool, before it was in. And so it was for 8 weeks. They did 1-hour online sessions of Zoom video conferencing for tele-yoga breathing. And what it is I'll just tell you a couple of very quick maneuvers. It's step breathing. So you take a deep breath and then breathe out in 3 steps. Like that. And you do it again, you do it in 10s. And then you do the opposite. So you do step breathing with exhalation. So you'll or inhalation. So you take a deep 3 breaths and then you breathe out. So you do step breathing with inhalation and exhalation. And they also did mindfulness practice. They did some meditation there. But then we looked at 10 people, and we had about 4 dropouts. We had 6 people complete the study. We looked at quality of life, shortness of breath. The primary outcome was forced vital capacity, which is this parameter we use when you come into the clinic and you say, breathe, 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 and then they measure your lung function. And so you can see here, there are 6 people. I don't know if you can see my arrow, but this is where everybody started at the beginning. And the FVC, as you know, as you have your ALS progresses, it goes down, 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 and then you get into trouble. But look at what our patients did. They stayed stable. One patient did get worse, but everyone else stayed stable. One person actually got better, but everybody was okay. Even 4 weeks or 2 months after this trial ended, they were okay. And my friend who's a pulmonologist said, Ginny, if this were a drug, the FDA would have approved it by now. So just to wrap up, a couple of tools that you can help that can help with your overall mindset is gratitude. Gratitude is being okay, being grateful for what you have right now. And that's what happiness is, because think about what your mind is like when you want something. Please let me have this. Please let me have this. Please, 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 please. It's anxious. It's worrisome. It's tense. But when you say, hey, thank you for letting me be here another day. Thank you for my caregivers. Thank you for the people around me. Thank you for Les Turner. Thank you for my doctors. That tells you that you're okay in that moment. Your mind is at peace, and you're humble because you realize so many people are trying to help you. There's resources out there, and it's not just about me, me, me. And it helps you connect to the people around you as well. Gratitude exercises, what I do is I make a small gratitude exercise before I eat every single meal. And I'll say things like, thank you for all the beings who brought this food to my table. Thank you for all the beings that keep me safe. And so you can do whatever you want to. You can pray to yourself, you can pray to the universe, you can pray to, whatever your faith dictates. But there are so many things you can be grateful for and be grateful to. And I like this. If the only prayer you said was thank you, it'd be enough. And he was a German philosopher. And of course, acceptance. You know, I don't know why you have ALS. I don't want you to have ALS, but it is what it is. And Karen Mulcahy, who was the CEO of Xerox many years ago, said she was at a business meeting with this man from Texas. He's a cowboy businessman. And he said that one of the best pieces of advice is that she ever got was from him. And he said, the cow falls in the ditch. First thing you got to do is figure out how the cow got in the ditch. Or first thing you got to do is get the cow out of the ditch. Second is figure out how the cow got in the ditch. And the third thing is make sure the cow doesn't get in the ditch again. You're not going to be crying about, oh, the cow fell on my watch. I can't believe the cow fell in the ditch, and all these things. Just do it. You have ALS. I'm sorry you do. It's terrible, but there are so many things you can do to improve your quality of life and maybe prolong your life. Okay. So go to your doctor's appointments, eat, don't lose weight. If it's time for you to have respiratory support, go for it. And we're not talking about a trach. We're talking about AVAP, BiPAP, any kind of non-invasive mechanical ventilatory support. So something that can help you. These can prolong survival. And use all the tools you have. We talked about mind-body therapies, exercise, relationships, gratitude, patience. And with time and understanding, you will be able to understand, accept, and let go. And finally, the trail always changes. My friend who's a competitive biker, she's a pulmonologist, she will bike across the country in races where they get in and out of vans and go from San Diego to Delaware. But she was coming upon, she was in a mountain biking race. It was minus 30 degrees outside. She was coming up in a mountain in Utah and it was cold. She was freezing. She was just so tired and fatigued. It was getting dark and she couldn't do it anymore. And she remembered what her racing coach said. No matter how bad things are, the trail always changes. Keep going. Just keep going. And that's what she did. She kept pedaling and suddenly she came upon flat ground. The stars came out. She could see her breath among the trees. And she said it was the most beautiful thing she'd ever seen. So you just never know. Just keep going. We will fight with you. All right? Keep fighting. The ALS community will fight with you. And when you're tired, we will fight for you. So again, the things that are going to improve your quality of life and prolong life is non-invasive ventilation and an ALS multidisciplinary care center. Thank you very much. And I will certainly take questions now. I'm going to stop sharing. All right, maybe I'll start. I'll share more if they are questions. All right, Anne-Marie, please go ahead.
Yeah,
Thank you.
no, Dr. Tavee, thank you so much. That was just an incredible, incredible presentation. And such a great reminder, I think, for all of us, to practice gratitude, to practice mindfulness, all of that. I do have a couple questions. First question about, you mentioned ice cream. Can it be any type of ice cream? Is dairy okay? Non-dairy, frozen
Oh my gosh,
yogurt?
go for it. If you're not lactose intolerant, I mean, I was telling people to eat Snickers dipped in mayo. So, and honestly, to be frank, get real ice cream. Don't get the fake stuff, with the fake sugar. Get real ice cream, like, I don't know, I'm sure you have some kind of fancy place in your city, but Breyers, you can go get a gallon of ice cream, milk, cream, sugar, go for it.
And then, I mean, this is just the best news ever. Um, with regard to mindfulness, and I think I know the answer to this, because it's how I would answer if somebody had questions about like exercises or voice banking. But my 20 minutes of daily mindfulness, should it all be done in one sitting or can I break it up throughout the day?
You can do whatever you want to. I mean, obviously, if you can get good quality meditation, in longer periods, that's ideal. But if you can't, that's okay. Just do it whenever you can. And mindfulness can be done right now.
Yeah.
When we're sitting here, we can do mindfulness. When you're walking, you can do mindfulness. When you're driving, when you're going to the parking lot, sometimes I'll have the most incredible insights just walking to the parking lot from my car.
Yeah. I or I think about what do they say? The great ideas come when like you're washing your hair, just like in the shower.
Exactly.
Um, what about reishi mushrooms as a neuroprotective food?
So
Are you
again,
familiar?
we don't know what's really out there, and I don't think there are any well-known clinical trials in this particular kind of mushroom. But if it's safe, just have in small moderation. I would be careful. Again, there are a lot of supplements out there. Go to ALS Untangled, which is a website that's written by super ALS researchers who've done the legwork. And because there are already things that do have research in mouse models and clinical patients, I would go with those rather than the unknown right now, just because of safety and efficacy reasons.
Absolutely. And if you're on, approved FDA medications, we never really know how those may interact
Exactly.
with
Just
them.
like the lion's mane I think it was lion's mane and Tech. You got to be careful.
Yeah. And everyone, I put in the chat the website that Dr. Tavee just mentioned, www.alsuntangled.com. You can go to that website and it's phenomenal. What about deep sleep versus REM sleep? What is kind of preferred?
REM sleep. I mean,
REM,
sorry, deep sleep. You want deep
deep
sleep.
sleep.
Yeah. Yeah. But I mean, for you, you're not going to know if it's REM sleep, deep sleep. Just get sleep. And I want to just go back and make sure that I said it right with the supplements, because there was one that interfered with Tech.
Really
So
attack. Was it caffeine?
it was caffeine. I'm sorry. I misspoke. It's not lion's mane, it's caffeine.
Okay. And then one question, dill pickle juice or sweet pickle juice?
Dill pickle juice, just because it doesn't have all that sugar. There's a lot of things. If you look at sweet pickles, they put in corn syrup. They put in a lot of stuff. It's not just pickles. I mean, do you really want that sugar? I mean, yes, we want sugar, but we don't want corn syrup sugar.
Hmm. That's a really good point. And then when we're talking about diets for people living with ALS, what about those that may or may not have diabetes? We want those things that can be high in fat, but maybe not necessarily high in sugar. But what do you
So you
think?
do still have to be careful about the glycemic index, because with patients with ALS and diabetes, you also have the risk of having stroke and heart disease. So the last thing you want is a stroke when you have ALS, right? Which I've seen. I've seen that too. So things like bananas, just do everything in moderation. You can still have carbs. You can still have bread. There are low carb breads that you can have, right? Thinly sliced breads. There are things that you can do that are still healthy with low sugar.
Yeah, that's a really, really good point. Um, let's see, trying to get through this. We talked about
Berries are low sugar. I'm sorry, berries low sugar, peaches are low sugar. I'd be careful about red grapes, but blueberries have some of the same antioxidants. Okay, sorry.
no, that's great. And then a couple questions kind of on a spectrum. One would be, how do you, or what do you consider, is there like a clinical model for rapid weight loss? Like, how do I know when I've had rapid weight loss?
If your clothes continue to fit, I mean, the easy way, I mean, if your clothes don't fit every month, right? And you're seeing worse and worse and worse. And it's not, I mean, you can weigh yourself, but it's a percentage of your body weight too. You're not going to be, if you're 100 pounds or 150 pounds, With ALS, it's just not going to be that way. And because you're losing muscle mass. So I would just look at the way your clothes fit. If it's getting looser and looser and looser, there's a problem. If your jeans are not as tight, like around the legs, just keep an eye on that.
And I do want to emphasize, you had said gaining weight is good, correct?
Yes, yes, except we just don't know the best way to do it. The other thing is, for those of you who go to the Les Turner ALS clinic at Northwestern, then I want you to talk to the nutritionist and you can ask them. They probably have more scientific ways of saying, this is rapid, this is not rapid. They have fantastic nutritionists there.
Yeah, totally co-sign that one. You had mentioned exercise. This question is related to resistance exercise, and I think that's something we have to be a little bit more mindful of.
Be very careful with
Yeah.
resistance. I always recommend more reps than resistance. So I would do low to zero weights. You know, if you're doing, you can do like 1 or 2 pound weights, that's fine. But you want to preserve muscle mass. You don't want to break it down. So be very, very careful. More reps, definitely.
Yeah, definitely. And then it looks like we have maybe two more questions. You had mentioned melatonin for sleep. Do you know, and I'm thinking this will have to go back to the person's individual doctor and the person caring for them, but what if they're having trouble sleeping? Would sleeping aids be helpful?
Yes. But melatonin, oh, you're talking about
Or
prescription.
like a prescribed pill?
Yes, I mean, if you, and I understand, I
Yeah.
get it. Anxiety is a big part of this. The unknown, right? Everybody, that's what we don't talk about. It's just the unknown. And so if you need it, it's okay. Just do it with the guidance of your physician. Be careful though, some things that are, very, very powerful, like Klonopin can reduce your respiratory, um, can suppress your respiration. So be careful, do it with your doctor.
Yeah, absolutely. And then another question just kind of relates back to cholesterol. How
Mhm.
important would it be to ingest a lot of fats? And there's maybe this connection of like the myelin sheath being made up of cholesterol. So
Different kinds, right? So if you're gonna go eat a big bag of Lay's potato chips, there's lots of cholesterol and fried chips. That's not gonna help your myelin, right? It's just a different kind. So if you're going to have cholesterol or you want good fats, avocado, and I mentioned that a few times. Avocado is very good for you. And that's good fats. Coconut, right? You can do coconut milk. I mean, this coconut water, it's fine, it's trendy, but you don't need that. I would just, and it's expensive. So just get the things with good fats. Nuts have a lot of amazing, great nutrients and fats. Walnuts, they're fatty, but they're good fats. Peanut butter. I think this
mm,
is a very important source of nutrients and protein for my patients with ALS. And I love peanut butter, and I'm American. That's why. I mean, it's just not American to not love peanut butter. And I'm just kidding, but okay.
no. Dr. Tavee, right off the bat, I just want to share with you, comments are coming in on how helpful this has been. This is the most helpful information I've been given since my diagnosis, a ton of thank yous. For everybody that is still on, this is being recorded, so we will have the recording of this presentation up on our website along with Dr. Tavi's slides, so you can kind of refer back to those within the next couple days or so. So just visit us at lesturnerals.org. Under our education section, there's a section just for the learning series, so that's where you'll be able to find them. The other, let's see, I'm looking through. Somebody just said chunky peanut butter, the best of both worlds. Um, and then let's see, hydrogen water. There's a lot going
Mm,
on with water. Also, have you seen
yes.
like the hydration supplements that you can add to water? Any thoughts on
Water,
those?
just water and
Water.
water from the tap, as long as it's good, clean water, it's fine. It's fine.
And then last question we will take here. And you kind of broached this, but why do you think there's so few studies on supplements in this population?
Well, a number of things, one, there's no rush to get FDA approval. That's how clinical studies get driven. They're by the pharmaceutical companies. This is the world we live in. It's about money, okay? But it's about helping patients. So there's not a lot of money because anybody can make ashwagandha, right? And the other thing is there's so many different preparations and formulations, and you don't know what's really in them, and you have to be careful. And the studies that have been out there so far have not been of great quality. They just get some, and it's expensive. Clinical trials are expensive. So those are the main reasons.
Thank you so much. Dr. Tavee, you were so generous with your time today. Thank you again so much for all your help. Everyone that's still on the line, I just want to plug that in November we have Dr. Bedlack, who is part of ALS Untangled. He's going to be presenting our next ALS learning series on what he's learned about hope in ALS and what brings him hope. So that will be Thursday, November 14th. Time change though, this will be 10 a.m. Central Standard Time. So also be on the lookout for that. To register, that registration should be up again within the next day or two on our website. I think that's it for today. Happy Halloween to everyone who celebrates. And again, thank you all for giving me your afternoon today. I really appreciate it. Everybody stay well and we'll see you in November. Bye.